Hello everyone, this is Dr. Ajit, Chairman and Managing Director of DDRcsrl. I stand before you today to introduce a revolutionary breakthrough blood test to diagnose breast cancer. We have had many tests to diagnose breast cancer per se. We have had self-breast examination, we have had mammograms, we have had ultrasound mammography, we have had the most sensitive currently that is there as the contrast enhanced MRI mammography, and also the newer ones which is not available in Kerala called as PET mammograms. See, all these refer to anatomical or structural changes, means when there is a lump which has grown to a size and it is felt by the person or by a doctor to actually pinpoint whether those changes which occurred in them are cancerous or not. And that was the basis of diagnosing these cancers in breast cancer. No doubt mammograms is the only investigation until date which has shown that early detection in a major way, and which has contributed to disease-free survival and longevity of life. Well, we have something new, which is a simple blood test which can probably diagnose breast cancer even 2 years before a mammogram or any of these anatomical modalities diagnoses blood tests. How? And how is this possible? Well, let's talk about the technology behind this blood test. Every breast cell has got a protein called as MUC1. And the tumor form of this MUC1 is present in more than 95% of cancers. This tumor form is present in the circulation in quantities which keeps on increasing with time only after the breast cancer has been switched on in that lady or a woman. So by testing a blood sample every 1 year or once in 6 months in high-risk individual, we can find the change from baseline value of this TMUC1 to while you test for the second time, what is the change? Now the question comes, how do we know whether they have blood cancer while we tested the first time? Possible. So in the US, the study had been conducted and they found out that there is a baseline cutoff value, which was very different from India. When we brought this test to India, what we did first was we collected more than 700 patient blood samples which were normal, did the same procedures as we did in the US, and compared these values with positive breast cancer patient values, and then derived that baseline cutoff value. So we derived a baseline cutoff value for Agkura Personal Score, which is this TMUC1 based test. The TMUC1 protein is also called as TAB004 antibody, which is patented in the US and across 10 countries, and more patents are being awaited. So this value of 20.7 is what is being derived as a baseline value for India. What does that baseline value mean? When a lady tests this TMUC1 and they find that this value is about 20.7, then she needs to go and do an MRI to make sure that there is no definitive lump. Now, in case she doesn't find any of those lumps at that point of time, 3 months down the line, she should repeat the test and see if it is increasing from 20.7 to a value that is larger than 15.9% and above. If there is a change in value from the previous value of 15.9 and above, we should consider that the process of breast cancer has been initiated or established in that person. So that means breast cancer is established, and now we need to find out where in the breast this cancer is. So we have multiple tools, contrast enhanced MRI, we can go with PET based molecular probes, or multitudes of other probes to look at it very closely. So that is why this blood test, which can be simply deployed and done annually in normal women and in high-risk women. Who are the high-risk women? The women with a family history of breast cancer, women with BRCA1, BRCA2 gene positive, women with higher dense breasts, which are in category C and D in the BI-RADS category, means every woman does a mammogram, and at that point of time it may be normal, but we can see that if the breast density falls into the category of C and D, that itself is another risk factor, and in those situations, mammograms could miss cancers at more than 50%. So that C and D category of BI-RADS is another risk factor. The next risk factor is, BI-RADS also has a reporting system where, category 3 and 4A warrants biopsies rather from wait and watch. So, but the yield in a 4A category is very low. It is as low as in general literature, what has been mentioned, it is as low as 3.6% or slightly higher positivity. So that's a very low index, can wait and watch. So in such situations, in 3 and 4, if you have serially increasing values in this high risk group, definitely you have this establishment of the process that this lady could be moving towards breast cancer. Now there is another category, women with ovarian cancer. They are routinely screened for BRCA1 and BRCA2 gene positivities. So once that gene is positive, they have a 50% more risk for breast cancer than the rest of the population. So there again, we need to have a tool. Otherwise, what is the choice in BRCA1 and BRCA2 gene positives? You have to prophylactically remove both the breasts, like what stars like Angelina Jolie and multiple other Hollywood stars have done. So other than that, now we have an option. In whom, at what time, when and where should this be done? So earlier, people were not even going for a BRCA1, BRCA2 gene test to see if they were genetically at risk to screen for breast cancer, or the possibility of what is the percentage in which they have, because there was no other test to actually tell them, when does it switch. The only option, if they turn out to be positive, was to decide whether they remove their breasts or keep doing contrast enhanced MRIs every 6 months to screen themselves. So we have a situation where you have a high risk but do not have the certain tests to address those issues. Now, DDRCSRL and Agkura Healthcare have jointly launched this blood test in India first, primarily in Kerala. From April it will be across India, and then globally to diagnose blood cancer. So this is a great moment for us, and it is currently available all across 209 units of DDRCSRL in Kerala. And please, if you have questions, you can call us at the number that is shown in this video for us to educate you or give you a call back to brief you or explain more on this blood tests.